Hi friends, good evening. Once again, welcome back to my channel Mogambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation. Also, these questions will helpful for your other nursing officer exam preparation. We are discussing important questions and answers. First question, variation in shape of RBC is called. Options, option A, reticulocytes, option B, poikilocytosis, option C, polycythemia, option D, pancytopenia. Question is, variation in the shape of RBC is called poikilocytosis. Option B is the correct answer. Option C, polycythemia. Polycythemia means excess RBCs or increased number of RBCs are known as polycythemia. And pancytopenia means abnormal decrease in RBCs, WBCs and platelets are known as pancytopenia. And first option, reticulocytes. The reticulocytes are slightly immature RBCs. Okay, and usually only 1% of total circulating RBCs are reticulocytes. They are immature RBCs. Move on to the next question. A client admitted to the hospital has edematous ankles. What should the nurse do to best reduce edema for the lower extremities? Options. Option A, restrict fluids. Option B, elevate the legs. Option C, apply elastic bandage. Option D, do range of motion exercise. Here the question is, a patient is admitted to a hospital with the complaints of edematous ankle. What should the nurse to do best to reduce the edema to lower extremities? That is, what is the symptomatic management we can give to reduce the edema of the lower extremities? That is the question. And the correct answer is option B, elevate the legs. Doing elevation or elevation of the extremities promote venous and lymphatic drainage by gravity. Thereby we can reduce the edema of the extremities. Okay, that is the best management among this option. Also we can do range of motion exercise, option D, but the main first thing is elevate the leg. Move on to the next question. 2 hours after a cardiac catheterization that was assessed via the right femoral root, an adult client complains of numbness and pain in the right foot. What action should the nurse take first? Options. Option A, call the healthcare provider. Option B, check the client's pedal pulses. Option C, take the client's blood pressure. Option D, recognize the response is expected. Here the question, 2 hours after cardiac catheterization, the patient was complains that there is numbness and pain in the right foot. This catheterization was mainly assessed through the right femoral root. Okay. What is the first nursing action after hearing this complaint? That is our question. Here in our question, the cardiac catheterization was assessed through right femoral root. So the symptoms numbness and pain was related to the risk of arterial perfusion. That is, the symptoms are associated with the risk of arterial perfusion. And thrombus is a complication of femoral arterial cardiac catheterization. So we must expect there is an absence of pedal pulse in the extremities, especially below the entry site of cardiac catheterization. So here the correct answer will come, check the client pedal pulse. Okay, option B is the correct answer. And first option, call the healthcare provider. We can inform this to healthcare provider or physician. We can notify this thing, but the main thing is first we have to assess the pedal pulse, then we have to inform to the physician, then take the blood pressure. Everything we can do first. The first action, that is our question, what action should the nurse do first? That is, check the client's pedal pulses. Move on to the next question. The specific gravity of amniotic fluid is options. Option A, 1.001. Option B, 1.010. Option C, 1.100. Option D, 1.101. What is the specific gravity of amniotic fluid? Amniotic fluid is slightly alkaline in nature and its specific gravity is 1.010. Option B is the correct answer. Volume of amniotic fluid we can see at about 12th weeks the amniotic fluid is 50 ml, and by 20th weeks it is at 400 ml, and 1 liter at 36th to 38th week, and at the term the amniotic fluid content will be reduced and it is about 600 to 800 ml. And another one important point, the fetus swallow about 200 to 500 ml of liquor every day at term. Okay. The next question, which among the following is the main clinical features of hyperthyroidism? Options, option A diaphoresis, option B dry brittle hair, option C menorrhagia, option D cold sensitivity. Our question is, what is the main clinical features of hyperthyroidism? Hyperthyroidism means there is a hyper secretion of thyroid hormone, especially T3 and T4. So once the hyper secretion of thyroid hormones may cause increase in the rate of body metabolism. So thereby heart rate will increase, temperature will increase, BP will increase, there is hypertension, then tremors will come, mood swings, anxiety, diaphoresis, weight loss, heat intolerance. All the signs and symptoms will occur in case of hyperthyroidism. So here the answer is diaphoresis. Option A is the correct answer. One of the main signs and symptom of hyperthyroidism is diaphoresis. And the next question is, the cell organelles responsible for the formation of acrosome in a sperm is? Options, option A ribosomes, option B mitochondria, option C Golgi bodies, option D lysosome. And the correct answer is option C, Golgi bodies are responsible for the formation of acrosome in a sperm. Move on to the next question, which is the correct placement of the defibrillator paddles? Options, option A lower right sternal border and apex, option B upper right sternal border and apex, option C upper right and left sternal border, option D upper left sternal border and apex. This is one of the ICU and emergency question. So which is the correct placement where we will keep the defibrillator paddle? Okay. And the correct answer is, we will keep upper right sternal border and apex of the heart. Option B is the correct answer, upper right sternal border and apex. So see here we can see like this we will keep the defibrillator paddles. Move on to the next question. The instrument used to measure the intraocular pressure is called? Options, option A goniometry, option B tonometry, option C ophthalmometry, option D ophthalmoscopy. Here the question, which instrument is used to measure the intraocular pressure? And it is tonometry. Option B is the correct answer. Tonometry is a method of measuring intraocular pressure, and the normal IOP intraocular pressure is 10 to 21 mm of Hg. And the next first option, goniometry. Goniometry is the art and science of measuring the joint ranges in each plane of the joint. So it is used to measure the joint range of motion, goniometry. And the next option, ophthalmometry. Ophthalmometry means it is used to measure the corneal curvature of the eye and their deviation from the normal, especially in case of astigmatism and all. It is measuring by means of ophthalmometer. That is known as ophthalmometry. Then the last option, ophthalmoscopy, is an examination of the back part of the eye, that is fundus, examination of the fundus of the eye, which include retina, optic disc, choroid and blood vessels. That is known as ophthalmoscopy. Move on to the next question. Urine urge occurs at what bladder capacity? Options, option A 100 ml, option B 150 ml, option C 250 ml, option D 400 ml. So urge, urine urge, there is a positive urine occurs at what capacity of the bladder? It is about 150 ml. Option B is the correct answer. And the next question, increase in urine specific gravity occurs with all of the following conditions except? Options, option A high protein diet, option B dehydration, option C decrease in renal perfusion, option D diabetes insipidus. Here the question is, increase in specific gravity of urine occurs with all of the following condition except. That means low specific gravity of urine is seen in case of which condition? That is the question. So it is seen in case of diabetes insipidus. Option D is the correct answer. In case of diabetes insipidus, there may be polyuria may experience to the patient. Polyuria means 4 to 24 liters of urine per day. Okay. Diabetes insipidus occurs due to hyposecretion of ADH hormone. And also patient may experience polyuria, low specific gravity of urine. Low specific gravity means it goes 1.006 or it's low. And patient may have tachycardia and postural hypertension. It is mainly due to excessive urination and without rehydration. Okay, patient is not getting water properly means there may be chance of postural hypertension. Here the correct answer is option D, diabetes insipidus. We are discussing important questions and answers. If it is useful for your studies, please share my videos to your friend circle.